I have now Dr. Carlos Lopes joining me from Cape Town, South Africa. Dr. Carlos Lopes was the Executive Secretary at the United Nations ECA. Dr. Lopes, thank you for joining me today from South Africa. Good morning to you from Abuja, Nigeria.
Good morning.
How are you doing today? I hope you're staying safe.
Under lockdown.
Okay, just before we get into the discussion proper, speak to me about the situation in South Africa, what we're seeing, because here in Nigeria, our lockdown has been extended by an additional 2 weeks. What's happening in South Africa?
We have also a lockdown extension of another 2 weeks, meaning until the end of the month from the previous date that was announced by the president. It's a very stringent lockdown, not like in Nigeria. Here is the entire country, and there is very little movement. So I think we are going to have probably very good results out of it in terms of the pandemic, because South Africa has been able to control the infection increase and the community transmission.
Okay. So let's take it from there, Dr. Lopes. You were at the ECA, that's the Economic Commission for Africa at the United Nations, from 2012 to 2016. So you were at the period where we were also trying to figure out what Ebola was, how Ebola was impacting the continent's economy. You were tasked with also figuring how that would go. Would it also be proper to say that you are the AU's High Representative to Europe? Because I saw that. Please do confirm to me. Oh, fantastic.
Yes.
So congratulations, 2018. Till now, congrats. Okay, let's move ahead. You were tasked with figuring out how Ebola was for Africa between around that time. Speak to me about how bad COVID-19 is for Africa at this time.
Well, at the time of Ebola, the issue was mostly concentrated in a few countries, namely Guinea, Conakry, Sierra Leone, and Liberia. And the other countries that were also affected managed it very well, including Nigeria. So it became just a pandemic concentrated geographically in 3 countries. And I remember at the time, there was an estimate that the impact in the African economy was going to be $33 billion. It ended up being only about 3 billion, so a fraction of what was announced. So most of the pessimistic views about the capacity to respond to the outbreak proven to be wrong. Obviously, the 3 countries affected were very much in the doldrums, but this has not really been something that, attained the whole of the continent. Now, this time it's a global pandemic, and Africa is going to be attained in a completely different way. Most of the impact is not going to come out of the makings of Africa, but rather the contextual global issues that are going to affect Africa. There is a complete stoppage of economic activity in the world that creates very depressed commodity prices. We have 35 countries in Africa that depend heavily on commodities for their public resources, because 80% of their exports come from commodities. We have a complete stoppage of logistics because transportation has been deeply affected by the measures that have been taken around the world. And we have the macroeconomic environment that is not favorable to Africa, precisely because the stimulus packages that are being put together in the developed world are going to make most of the capital migrate from more risky places to these central economies. We know that is already an amount of about $84 billion that have migrated from developing countries to central economies. So that is very worrisome. It also affects our currencies, like the Naira, like the Rand. They have been losing ground in relation to hard currencies. So that means that our debt goes up in local currency quite significantly. So the combination of these factors that are not Africa's making are going to be devastating for the continent this time.
You know what just came to my mind, Doctor? And let me ask you this question. Would it have been different, let's say, that the pandemic originated from Africa and traveled to the West, but now is the other way around? The pandemic, COVID-19, started from the West and it traveled all the way to Africa importation. Would it have been different?
Well, actually, it's like a paradox, a bit like the climate paradox, where we are the ones polluting the least and the most affected by climate change. What we call climate injustice. Here is pandemic injustice.
Yeah, true. You've just characterized it for me. Now, Africa started 2020 with a positive outlook. About 5 or 6 of the fastest growing economies in the world, Africa, the likes of Rwanda, Ethiopia, Senegal, in the averages of 6 to 7%. Now we're seeing that this is a bit dented. I don't even think that these economies or most of our economies in Africa may even be positive, even as we move towards the end of 2020. With putting this in perspective, can you characterize for me Africa's response so far, health-wise and economically, because they do go hand in hand? This pandemic has shown us that investing in healthcare is not just about service delivery in healthcare, but about economic security as well as national security. So can you characterize for me, in your own words, Africa's response so far to this pandemic, health-wise and economically? How are we doing?
Well, in fact, our forecasts before COVID-19 were even better than what you mentioned. We had 16 countries out of 30 in the highest performance category. So by far the largest in terms of regional presence. We had a forecast by the IMF that predicted 21 countries in Africa would be having 5% or more growth this year. And they represented more or less half of the population of the continent. So this was really a very good year in terms of progress and actually confirming the trends that I've been seeing from the beginning of this century of Africa really doing reforms and improving its management response capacity. Now we are faced with something that is quite daunting, because not only it requires a very stiff response in terms of health and sanitary precautionary measures, but also treatment-related expenditure that is going to skyrocket, but also the economic impact that is going way beyond what anybody could have imagined, because we are going to have a complete stoppage of activities in many sectors. Add to that the fact that we are going to count less on remittances, which is a source of external funding that has been quite regular and has been providing us some degree of stability, and is going to be affected because the diaspora cannot contribute the same as usual. So what has been the response? The response has been a combination of macroeconomic measures and health precautionary measures, like the confinements, the lockdowns, the various attitudes that African governments have had so far have been effective, but we need more if we are not going to enter into a period where our health systems that are quite fragile are going to be overwhelmed. And this has been more or less the knowledge from previous experience in other regions of the world. And I think we have not yet the full dimension of the infection, because our data systems are not of good quality. So there is a lot of infections that are not detected because of the data systems, lack of testing, and the like. And we have also to bear in mind that we are going to be probably the last epicenter of the pandemic. the pandemic has been moving geographically, and Africa is likely to be the last to be affected immensely by it. Because it came from the East, it Europe first, now the US, and I think after the US is going most likely to be Latin America that is going to suffer the most, and then eventually it will hit Africa hard towards the end of this first wave. But it is in the interest of the global community to give support to Africa, because otherwise the virus is going to be sheltered in Africa. And a second wave can depart from Africa. This is very easy to explain because, you cannot quarantine inequality. You cannot quarantine poverty. So if you actually act as if it was just a problem of one country, you are just going to wait for the next wave to hit you. So this has to be treated globally, and therefore it's in the interest of the global community to actually help Africa, not derail its reforms, and not deviate the money that normally goes to pay debt and international obligations from confronting the pandemic and investing on health.
You just cut me there with what you said. You can't quarantine inequality, you can't quarantine poverty, and those are two sides of a coin that Africa has been battling with, at least since I've been doing this show, perhaps since I was born, But let's move to the question of which you actually said, partnerships that we're seeing with Africa, so to speak. In the last few hours, we saw the IMF board approving debt service relief to 25 countries, and 19 of those 25 countries are African countries: Togo, Mali, Chad, Malawi, Madagascar, Sierra Leone, Liberia, Guinea-Bissau, DRC. My brain is failing me on the rest. I don't know how many I've counted out of 19. But how do you see these partnerships? That is with the IMF debt service relief. The World Bank has also announced a war chest of about, 160 billion from the World Bank, IMF $1 trillion. African Development Bank is also assisting African countries. How would you assess these partnerships with Africa? That's the A part of the question. The B part of the question is debt service relief, fantastic, at least from the IMF for the next 6 months, which will be reviewed as we go on. Should we be talking about debt relief or perhaps debt cancellation, debt forgiveness entirely?
Well, I think we should welcome the fact that the IMF has evolved from the beginning of the crisis to the position of yesterday, because they were talking about a moratorium of debt service, which means whatever we had to pay this year will be pushed ahead to be paid later, to the position of yesterday, which is to actually forgive the service for this year. The problem with this measure, nevertheless, is that it concerns only least developed countries. And we need much more than least developed countries, because some of the middle income countries in Africa are engines of growth in their regions, like Nigeria. So if you just attain the poorest countries with this type of measures, you are not going to have the impact that is required, because the economies need to function in its entirety. The second problem with this is that obviously the countries that have been selected represent a very small amount in absolute terms. So we are kind of putting aside the countries that are really more powerful in terms of the size of their economy, if that is very small in relation to the needs of Africa. So that's why we have to ask for much more. In fact, Africa needs no less than $200 billion worth of support if we are going to have the kind of stimulus that countries in the developed world are doing for their own economies. Now, some people will say, but are you asking for a gift? No. There is a mechanism in the IMF called special drawing rights, that comes without obligations can support and budgetary systems. And these special drawing rights are actually to be accessed in very specific and unique situations. And this is one of them. So I think it is absolutely normal to go all the way up and go into these special drawing rights and raise as much money as possible to contribute to this sum of about $200 billion to rescue African economies.
Now, do you see Africa having a more realistic and strategic response to contain the contagion, as well as economic fallout from COVID-19 pandemic? Or perhaps it's just like a copy and paste model from what we're seeing in the West and in the East? Will that copy and paste model work for Africa? Because we do have fragile health systems in Africa. We do have poverty, like you've mentioned. We have inequality, like you've mentioned. We do not have basic amenities. I think about 765 million people around the world do not have access to good water, and majority of those millions are in Africa. So will the copy and paste model that we're seeing in the East and the West work here? Can Africa come up with its own strategic and holistic response to contain the contagion and economic fallout?
No, we should have a different approach. And as much as lockdowns have been proven to be effective in terms of contagion, we cannot really afford to have lockdowns for too long and for areas of coverage that are too large. And the reason is very simple to explain. A lot of our economy is informal, which means that you need to have transactions on a daily basis for people to survive. And it's impossible for people to survive without those transactions unless they have a very strong safety net, which is not the case. Second, from a sanitary point of view, it's actually more dangerous to confine people that don't have access to water and some essential basic needs in places where, basically they will spread the virus more extensively because of density. So we need to deal with that by making sure that our response is much more on contact tracing, and it's much more inspired by what was done with Ebola, which is involving the community in the response, making sure that you distribute to the community through volunteer work, through special arrangements, the means for them to have their necessities met, and also to respond with sanitary measures that are community-led. And I think this is not being done enough, and we need to call the attention that Africa cannot just copy-paste what is done in Europe. And more importantly, we have to bear in mind that we have a locust outbreak in East Africa that is also contributing for the difficulties that people are facing. And we have one of the historic droughts in Southern Africa. So we just can't reduce this to a pandemic fight. It has to be a fight for livelihoods as well.
Yes, fight for livelihood, because what you've just said, even the low-cost invasion that we also saw in East Africa and all of that. So you can see some countries in East Africa, Uganda, Kenya, and other countries in East Africa also battling with the pandemic, and even the low-cost invasion that is also impacting on their food security and food supply. So many challenges for Africa at this time. But let me bring in this question, which is, what do you think, what does this mean for globalization? COVID-19 pandemic, what does this mean for globalization? Will it accelerate the isolationist trends that we're seeing, especially in the US and in Europe? What impact will it be? The isolationist trend that we're seeing, the nationalistic mantras that we're seeing in the West and that we're seeing in the West, what impact will it have, especially for Africa, as we even move, as we fight against this pandemic and possibly get out of it?
Well, in the short term, we are likely to see a rise on protectionism that was already present in the populist policies that have been promoted by many world leaders. But I think the overall trend is to dismantle the way we have conceived the global value chains. We looked for levels of efficiency that located most of the production in very specific geographical areas because of a combination of factors such as labor costs. And this is likely to change in the future because now the estimate of risk is going to be done in a completely different way. And therefore, there will be a spread geographically of the global value chains, which gives a chance to Africa because we are in latecomers when it comes to industrialization. So we can take advantage of this moment of truth that globalization cannot be done as before. Now, we are also likely to see a contraction of world trade that is going to create problems for the short term, but in the longer term, can contribute to relaunch it in a different basis. Like, for instance, logistics is likely to be deeply affected by the coronavirus, and we are going to see the emergence of new forms of transaction. And this is also something that Africans can use for promoting their free trade area, the integrated free trade area.
Yeah.
And finally, I think from the technological point of view, we are going to see an acceleration of the use of remote forms of work and also remote forms of financial transactions that were already quite prominent in Africa that are going probably to extend even further.
So, Doctor, when do you think this will be over? Is it possible to predict now? Or do you have your crystal ball in front of you to predict when it will be over? And do you think that Africa will return to the pre-COVID-19 normal, or will there be a distortion? That's the A part of the question, because I have less than 5 minutes with you. The B part of the question is, do you also see Africa emerging into a new world that COVID-19 has created with other continents?
Well, in short, I think we are the last that are to be affected by the pandemic, so we should expect that it will reach us in terms of peak much later than the other parts of the world, which is good. At the same time, it creates more unpredictability for 2020. So I would say that this year is lost economically. We are going to have negative growth for sure, and we are going to have deep negative growth most likely. But I think 2021 is not going to be easier as well, because we are going to have a very slow recovery because of our macroeconomic context. And I think that we should prepare ourselves for 2 years of pain, with 2021 in the second half being better.
Wow. Okay. What hopeful linings do you see in Africa at this time? Even they say in every crisis there is an opportunity. Are there opportunities for us as Africans? Are you even seeing hopefulness in the midst of this pessimism, in the midst of the minuses across board?
If we take a philosophical view of this crisis, we have to admit that viruses have proven to be much more lethal to older people. Well, it just so happens that the oldest societies in terms of age composition are the Western societies, and the youngest are the African. So that gives us a bit of hope that yes, we'll have a lot of virus. This is just one of many that will manifest in the future, because there is an acceleration of that type of phenomena because of connectivity. So this will give a bit more of respite to those naysayers that always see Africa from a negative angle, because they will have to now admit that it's not a very good prospect to keep saying that developed countries are going to survive with robots and old people.
Prof, in your book, Transformation in Africa, in one of your books, because I know you've written many books, in one of your books, I think the title is Transformation in Africa, correct me if I'm wrong, do you still see transformation amid COVID-19 pandemic?
I think what we are seeing already is that the countries that have very strong reform credentials are doing much better in the response to COVID-19 than those who have been sort of dragging their feet. So this is a very good indication that transformation is taking place and it's there to stay.
Which countries do you mean?
I think certainly countries that have responded extremely well to this pandemic include countries like Ethiopia, like Rwanda, like Mauritius, like Morocco, like Senegal, which are all countries that have been very well endowed in terms of, introducing reforms and industrialization.
Now that brings me to the question, countries which you've mentioned. I remember in 2001, heads of states, about 52 heads of states in Africa converged on Abuja, that's the capital city of Nigeria, to say that 15% of their yearly budgets will be dedicated to the health system. We've just seen a few countries doing that. Rwanda, I think, did that. Senegal, Zambia. How much importance is this COVID-19 pandemic staring us in the face that Africa doesn't need a fragile health system? Because just like I said earlier, is now modern delivering healthcare services, but it's about economic security, it's about national security.
Well, I would agree with you in general, but in the specifics, I would say Africa has proven to be quite serious about health systems, because we have reduced our mortality, both infant and maternal mortality, by half in the last 10 years. We have turned the curve in terms of response to HIV/AIDS. So there are indications that are quite important that Africa has been able to increase its capacity to respond to health challenges. But obviously that is not enough. We come from a very low base, and we'll have to prepare ourselves for more.
Prof, let me just snuggle a bit with you. Let me fight you a bit, fist fight on on this, because according to the Brookings Institute, I think 2015, Africa has 23% of global disease burden. And you see that African leaders, that's also taking me to the leadership question in Africa. African leaders, or most or some African leaders, you see them travel out of their countries to seek medical care and medical treatment abroad, as little as even checkups. We saw what happened in Zimbabwe. Robert Mugabe even died, I think, in Singapore. You're seeing Cameroon's president, most times he's not even, is it Paul Biya also? He's not even in the country. Our own Nigerian president in 2017 went to the UK for many months for medical checkup and all of that. So, what would you say about that?
Well, obviously you are right, but we have to put it into context. First, I would say it's very important to mention that this disease burden is practically intact over the last 20 years. So it is not the one that is responsible for improvements. We have been neglected by the pharmaceutical industry, and our own pharmaceutical industry is in its infancy, and we need to actually do industrialization and transformation, and that is going to create a capacity that is commensurate to our challenges. Okay. And depend less on the burden being treated by others.
Okay, I think, Doctor, we'll leave it at that. Thank you very much for joining me today. Hoping to speak to you sometime again as this unfolds. Thank you very much for joining me from Cape Town, South Africa.
Thank you, Nancy.
All right, I've been speaking with Dr. Carlos Lopes, the former Executive Secretary of United